Hey guys, so something else that I wanted to talk about that was TTC related and that I feel needs to be included in this new TTC journey is, well, most of you know that if you've been following me and watching that I have PCOS and I have insulin resistance. And that played a huge role in me trying to conceive my daughter. It took us around 3 years to actually get pregnant. My body just does not like to ovulate. And I have anovulatory cycles, so I have a period every month, but I just don't ovulate every month. Something that I did not share in my past videos and that I haven't really spoke to many people about, maybe some very, very close people to me, just because, I don't know, there's always been this fear around it, but since I was a teenager, I've been having, I guess I like to call them flare-ups or episodes where I have severe pain in my pelvic area. When I was very young, teenager or preteens, whenever I started first getting my cycles, I would have this pain maybe once or twice a year. Not very often. It would come out of nowhere, and it only would last about 30 to 45 minutes, and then it would be over. And I didn't know how I would explain that to somebody. And I was always afraid that they were just going to tell me I was constipated or, you know, something, and blow it off. So I've always kind of kept it to myself, and because it wasn't something that happened all the time and it was very just sporadic and I couldn't explain it, I just dealt with it. Well, when I started getting older and while we were trying to conceive, I noticed it happening a little bit more frequently, and still something that I kept to myself and didn't tell anyone about. But after getting the PCOS diagnosis and having confirmation that I have cysts on my ovaries, I kind of diagnosed myself to it being cysts bursting, for me having a cyst burst. And then after doing research about cysts and them bursting and having cysts and the care for cysts, and I realized there's nothing that anybody could do about it anyway, so I might as well just continue to keep it to myself. And then when I started doing the Clomid a couple of years ago, it got worse. The last few rounds of Clomid, I started having this pain every month around the time that I would ovulate, and it was more excruciating, more horrific. I mean, just bring me to tears, put me in the fetal position, couldn't walk, and the episodes started happening for a more lengthier period of time. Hey, you gotta be quiet. I'm making a video. Here. So, once again, I thought it was just this Clomid is like stimulating my cysts and making them bigger, making them more painful, and I had ultrasounds that confirmed that I had cysts, and so doctors were saying that's probably what it is. And then once again, there's really not much you can do about having cysts except taking like hormone therapy, birth control, which I didn't want to do because I was trying to get pregnant, and I didn't want to slow that process down, you know, any more than it already was. And so the entire time that I was pregnant, I did not have this pain. And about a week and a half after I gave birth, I started having the pain again, except it was severe, the worst that it had ever been. And I couldn't care for her, I couldn't hold her, I couldn't breastfeed her, and it was happening sometimes multiple times a day, day after day. And I called my doctor's office and I said, you know, I'm having this horrible pain, and it feels to me like when I would have cysts burst and, you know, when I would ovulate. And they got real snooty with me and said, you know, it's not possible for you to be ovulating or for you to be having, you know, cyst issues. You just gave birth to a baby, you know, and they blew me off and told me to take, you know, ibuprofen. So after a couple weeks, that pain kind of subsided, and then it went back to its regular every single month around the time that I ovulate. I mean, I can pinpoint it to almost the day that my little app would tell me I'm ovulating or my physical symptoms would show that I'm ovulating. I would have this pain, and every month it gets worse and worse and lasts longer and longer and keeps me from cooking, cleaning, caring for my child. I've had it happen at my job where I just have to hide in the bathroom and have someone else take care of my patients. And then a couple of weeks ago, it kind of got got to the point to where I just left work and went to the emergency room, and they did some ultrasounds and they ran some tests and a pelvic exam, and they the ER doctor asked me if anyone had ever talked to me about endometriosis, because to him that is very similar to what my symptoms were. He said I did have cysts on my ovaries and that it was possible that that's what it was, but that I needed to have a follow-up with my OB and have that checked out. So I called my OB at the time and they refused to see me and kind of gave me the same spiel about how if it was cysts, there's nothing they can do. If it was endometriosis, there was nothing that they can do but do laparoscopic surgery and explore, which apparently that's something that they didn't want to do. So they wanted to refer me to a pain management clinic, which I thought was kind of crazy because they hadn't even seen me yet. So I dropped that OB, found my new OB, made an appointment with him about trying to conceive baby number 2, gave him my whole history, talked to him about the pain, and he is very, very convinced, he could be wrong, I could be wrong, but he's very convinced that it is endometriosis, and he wants to do laparoscopic surgery to explore my pelvic area. He wants to look at my intestines because he thinks that some of that intestinal pain and intestinal issues that I'm having are being caused by possible endometriosis. And then the ovulation pain that I'm having, the period pain that I'm having, you know, all of it in my pelvic area, all the problems that I've been having for so many years, and then the pain progressively getting worse, he thinks it all could be endometriosis. So the plan is August 1st, I'm gonna go in and have, they're gonna go in with just a scope and a camera and look at everything. If they find it, then they're gonna make a couple more incisions, and then they're going to remove as much as they can if they can. And hopefully that will help with my pain. And he says that a lot of times that will contribute to infertility. And so although I have the PCOS and that probably contributes to it, and the insulin resistance probably contributes to it, there's a possibility that if there's endometriosis, it could also be contributing to us not conceiving so easily. So he's not saying that removing endometriosis from my ovaries or tubes or uterus or whatever is going to make us get pregnant magically, but he thinks that it will definitely contribute to us trying. And he said even the next cycle after the surgery, we can start trying with ephemera. So August, the end of this month, I'll have my period. The beginning of August will be my 3rd cycle TTC for baby number 2. I'll have the surgery, and then hopefully by the 4th or 5th cycle, we can start taking the ephemera along with the metformin, and maybe by Christmas, I'll be pregnant. So that's just kind of what's going on and why there's going to be a delay with taking the ephemera and kind of a delay in TTCing, and why we didn't try so hard this cycle, because I don't want to end up pregnant and then not be able to have the surgery and have to continue with the pain and yada yada yada. So I will keep you updated on my surgery and everything that goes on with it, and then of course let you know what comes of the surgery if I do have endometriosis. And just kind of, I don't know, this is all new to me, so it'll be a journey for me, and hopefully bring you guys along and maybe help somebody else who is going through the same thing. So thank you for taking the time to watch, and I'll see you guys later.